Hi, I'm Femi OK. Today on the stream, we focus on Haiti, a country that is yet to receive a single COVID-19 vaccine. Some Haitians are even struggling to be able to afford COVID-19 basic safety precautions.
The state government is supposed to give us masks to wear for the coronavirus. But they don't give us the masks, and we don't know where to go and buy them. They sell them at too high a price for us to be able to afford it. We're poor. We can't afford them. Therefore, we don't wear masks.
Meanwhile, President Jovenel Moïse of Haiti is facing some political opposition. The economy is struggling, and also there's an uptick in gang violence. There's so much to talk about in Haiti right now. Please help me do that. Jump into the comment section and be part of today's show. Joining our conversation, Minister Joseph, Jacqueline, Dr. Pop and Jessica. Nice to see you guests. Thank you for being with us today. Minister Joseph, introduce yourself. Tell everybody who you are, what you do.
Thank you. I'm Claude Joseph. I'm the Minister of Foreign Affairs and Worship in Haiti.
Jacqueline has been a friend of the stream. She's been on the stream many times. Welcome back, Jacqueline. Remind our audience who you are, what you do.
Thanks for having me. I'm Jacqueline Charles. I'm the Caribbean correspondent at the Miami Herald.
Dr. Pop, welcome to the stream. Introduce yourself to our global audience.
My name is Bill Pop. I'm director of Gishko Centers in Port-au-Prince, Haiti. I'm also professor of medicine at Weill Cornell Medical College in New York.
And Jessica, good to see you. Tell our stream audience who you are, what you do.
Yeah, hi, my name's Jessica Ober. I'm a journalist and filmmaker based here in Haiti.
Welcome, everybody. Dr. Pop, let's just start with some very basics. How is Haiti doing regarding the COVID-19 pandemic? How many people are sick? How many people have passed away? How are you handling it?
Well, I must tell you that I'm the one who had announced a catastrophic situation that would have occurred, and it didn't occur. We have in total 252 deaths. We have about 13,000 people who've been infected, but I suspect that this number is much lower. I would multiply it by 20 because we didn't test every single person. We only tested people who were symptomatic and who came to our centers. But we are not seeing a second wave at this time, and we are looking into why this is happening. It's fascinating that we are not seeing much COVID right now. We had Carnival, we had reopened schools, we had reopened airports, and nothing happened. So I presume, based on some data that we have reached some kind of collective immunity in the population.
Dr. Pop, this is so strange, as you said. I'm just looking here at COVID figures for Haiti. Now, of course, any country's figures are not going to be absolutely accurate because you're not going to be able to test every single person. And also, there's not a lot of COVID testing going on in Haiti anyway. But look here, number of cases, 12,000, deaths, 252. That's extraordinary. Neighbouring, next door to you, Dominican Republic, they've had 258,000 cases and more than 3,000 people have died. This is something, Jess, that you have looked into. What theory do you have?
Right, so I had written an article for the New Humanitarian about vaccine hesitancy. The reality is that the death toll and confirmed cases are quite unreliable. Less than 60,000 tests administered in Haiti rather than the 1.3 million in Dominican Republic, with roughly the same population size. Also, most tests are quite unaffordable to the general public. They cost about $90. It's just not possible for most Haitians. And most people, actually, doctors I've spoken to, both in Port-au-Prince and in the provinces, have mentioned that most people don't go to the hospitals when they have a fever or a flu. There was a lot of stigma at the beginning with the pandemic. So instead, it's kind of been denoted as a different fever, not coronavirus. So the people dying at home, they're going undiagnosed. It's not being counted as COVID.
Jacqueline, go ahead.
Jessica, could I intervene right here?
Yes, Doctor, go ahead.
I've been working in Haiti for 40 years. I've seen all epidemics, from children diarrhea to AIDS, TB, dengue, cholera, etc. I can tell you that we have community health workers working in the slums who live there. If we had a lot of COVID deaths, we would have known. This is the reality. Of course,
but it's linked to different underlying conditions. I know people who I've spoken with.
Well, but I think, let me just say that I was in Haiti when cholera.
So guess, let me just go to Jacqueline, and then I'm going to go to the minister. Jacqueline, go ahead.
I'm just going to build on Dr. Pop's point, because I did a story about this, and I was in Haiti during cholera, and I remember the bodies being thrown in the streets, left in the streets. You saw people running with bodies, sick people on a near death on planks, and that is obvious that we have not had that in Haiti. Yes, you can question the numbers, you can question the figures, but the reality is that we have not seen any anecdotal evidence of large numbers of unexplained deaths that we saw in Ecuador or that we've been seeing in Brazil. The question fundamentally is, why is this? We know we're dealing with a country where over 50% of the population is young. So you don't have that, older population. You do have some comorbidity. People do treat it as if it's just a fever, but they're also treating it with different herbs and different teas. There is a question to be asked. Let's be real, part of the country is closed down. It doesn't have the amount of tourism that we've seen next door in the Dominican Republic, and we see how this virus moves. So there is a legitimate question there. But I agree with Dr. Pop is that when we look at the history of Haiti and the diseases in the past, there has been no, evidence to have you believe that we have a situation in Haiti where you've had, like in Ecuador or Brazil or other countries, where you've seen this explosion and people are dying in large numbers unaccounted for.
So, Minister, it almost feels like Haiti has dodged a bullet for the moment. Is that to do with how the government is managing it in terms of the COVID-19 pandemic?
Thank you. Listen, first I concur with Dr. Pap and Jacqueline. Had we actually have many COVID deaths in Haiti, everyone would know. There is no such thing. We need also to mention that the government has been very proactive since the beginning. We closed schools, universities, port, and airports. So we need to also take into account those parameters. I do believe that the government has been very efficient in managing the COVID-19 in Haiti. So it's clear that we are among those countries, according to a report, that actually best manage the COVID-19. Of course, we need also to understand other factors that help us compare to our neighbor, Dominican Republic, why we did so good in actually managing.
Minister, I would disagree with you. I think that the government's handling of COVID has been rather chaotic. I mean, I think that Haiti has managed to dodge a bullet, but let me just say, one of the worrying things that has happened is that when you look at today, for instance, the State Department, put Haiti under a travel forewarning, and they specifically also mentioned the COVID because it's under CDC. So they're saying to us they don't believe the numbers. The Bahamas also, effective today, has another ban on travel to and from Haiti. It's the third time that they're issuing this ban. I mean, I think that there's definitely an answer for the scientists and individuals like Dr. Pap to realize. But I think that, yes, in the beginning, we saw some proactive decisions on the part of Haiti, being the first to say to people, if you're coming in, you're going to have to self-isolate. But then that didn't happen. We saw the rooms that were set aside for isolation. They were going to people who were being deported from the United States. That's a whole other issue and a whole other topic. But and you see some of the images that are coming out, and people may not be able to afford masks, but people don't believe in masks and they don't want to have masks. So I think that we have been lucky, but I think that when we look at what's happening in Papua New Guinea, we look at what's happening in Venezuela, the realization of these variants, that the government can be more proactive. And that it is critical that, people understand that while, yes, we're not seeing the number of deaths in Haiti, this virus is real, and that they should not just dismiss it as just a little fever.
So, guests, let me just move on. Let us move on a little bit, because this is almost a medical mystery that we are not going to solve within the length of this programme. But I do want to push on just a little bit, because where Haiti is right now, and it's been shocking some of our audience who are watching, Haiti doesn't have a single COVID-19 vaccine. The Director of Health Ministry explained some of the challenges that Haiti is anticipating when it even comes to getting the vaccine in country. Let's have a listen.
If we have 3 million doses of vaccine, first, do we have a safe place to store them? Second, do we have the capacity to use all those doses before they expire? Because when you receive the vaccines and then start using them, they could end up expiring. We have to know all these details before we can start receiving vaccines and saying to people that those vaccines are available.
Dr. Pop, this is something that every country is having to think about, whether they are a developing country or a developed country. So is Haiti ready to get vaccines?
Okay, let me explain. This is a complex issue because we are a vaccine center at GESCO. We've used vaccine against HIV, against HPV, and most recently we introduced oral cholera vaccine. Whenever you introduce vaccine in a population, it is essential that you do sensitization and information in the population. And I can tell you, people tell you that the government doesn't give them masks. I know that there were millions of masks that were provided. The reason really why people are not using masks, because they could make them themselves. It's really because they don't believe in the disease. And they don't believe in it because they don't see people dying around them. That's really the issue. They believe in cholera, it was easier. So I think the government position essentially is linked to the fact that we don't have a lot of people over the age of 65. So this is why they recommend that vaccine mostly for older people. It's only 4.5% of people over the age of 65. But most importantly, it's convincing people to get it. So they're afraid to get vaccine, and the vaccine sits there and expires. So there needs to be a large campaign. We discussed this at a previous talk with Kester Farrell this morning. There needs to be a huge effort, and it has to start also with diaspora. That's what I did with the Haitian Medical Association overseas, and making sure, because there is a connection with the diaspora in Haiti. That's what I did with cholera. That's what I did when I introduced HIV vaccine. So we need to do that first. This is important. And I think that the government is not against vaccine because they sign the documents indicating that they want vaccines. But they want to make sure that this is not wasted. And I think that the first step is that massive education campaign. It's not going to be easy, I can guarantee you.
But Doctor, what month is it? It's April of the year after we're in a global pandemic, so it's over a year, and so you're still at a situation where you're persuading Haitians that COVID-19 even exists. Minister, how are you going to do that?
I mean, I know that the public health ministry is very proactive. And as Dr. Pap just said, they are diligently working to accept. They refuse, or at least they are very reluctant to choose the AstraZeneca vaccine. And they have the right to actually listen to the, for instance, bioethics committee to get a clear grasp of which of the vaccines may work better for Haiti. So I think this is where we are right now. The hesitation that exists among the population, but as Dr. Pap said, the government has already signed a document to accept the vaccine. But which one? I think there is a discussion, and this is something we should figure out pretty soon and start with the vaccine. And again, we need to have a campaign,
how quick is,
and this is exactly what...
Minister, I'm just wondering how quick is pretty soon. It doesn't feel like there's an awful lot of urgency because, one, Haitians don't really believe it exists as a pandemic, and two, not that many people are dying.
I mean, the reality, too...
I just spoke with the Minister of Public Health, who actually said that is going to be very, very soon.
Very
But
soon.
we express our concerns about AstraZeneca, and we are still waiting for them to actually say, to address those concerns.
Right.
But right now, there's only one vaccine that's available, and that is AstraZeneca. I mean, in the United States, you have J&J. It is a one-shot vaccine. It has not been approved by WHO. And the reality is, because Haiti is part of the Covax, 36 countries in the Americas region are going to receive vaccines through this. 10 of them, including Haiti, are going to get it for free. But Haiti is only going to be able to get 20% of its population in terms of vaccines. And that's a real reality, that once you get enough for your 2 million individuals, you will not be able to have any more vaccines. So today there's one vaccine, AstraZeneca, and while we haven't moved to a global passport, increasingly as a journalist, I am seeing countries that are starting to ask for people to be vaccinated, and everyone agrees, at least the science agrees, that we need to reach herd immunity, and we can't reach herd immunity if one country is lagging. It's understandable Haiti's concerns, but all of the scientists are saying out of Europe is saying, yes, there are some concerns, but the benefits outweigh the risk right now. And by the time Haiti actually let Gavi know that they were prepared for this vaccine, 9 countries in this region had already received their shipment of AstraZeneca vaccine for COVID.
So Jacqueline, let me just remind our audience who Gavi actually is. It's the Vaccine Alliance. And we spoke to them. We talked to them about this Haiti show. Have a look here on my laptop. The Covax vaccine request form invites countries to identify their preferred vaccine characteristics. Now, they sent this to us in direct response to what is happening in Haiti. I'm just going to skip towards the end here. Covax seeks to optimally meet the full range of country preferences subject to supply availability, among other factors. So maybe the J&J vaccine will be available, but maybe it won't be. There's a comment that I would love you to listen to, Minister, and this comment comes from a citizen of Haiti, and he is concerned that the vaccine is not the biggest issue in Haiti right now. There are many other issues way more important. Have a listen, have a look.
First and foremost, there is a deep mistrust in the relationship between the Haitian population and the government, which is known for corruption and its incapacity to provide the basic social services to the citizenship. Actually, few people die in Haiti because of COVID-19. Haiti does not have a problem of COVID-19 vaccine right now, but a problem of insecurity and bad governance. So Haitian people should be able to elect by their own their elected official without any interference of the international community.
Minister, go ahead.
Yes. Listen, Haiti has historically a number of structural problems, including a constitution that has not worked, or including a constitution that has undermined democratic progress. This year, we have an opportunity to address finally these structural problems, providing the country with a solid platform on which to build a stable democracy with functional parliament and strong institutions. Listen, 2021 is a crucial year for the country. Haiti's success is predicated on holding free and fair elections. As the professor just mentioned, we need to hold elections so the people can elect their leaders and to finish with the cycles of instability and violence. We need to change the constitution, as 90%, both inside and outside the country, 90% of Haitians, both inside and outside the country, ask. They want redrafting the constitution. They want elections. So in 2022, we can have a peaceful transfer of power. An elected president will replace President Jovenel Moïse and have a climate of an environment of stability to really lead the country to the better path.
So I'm just looking at YouTube, Minister, and there are a number of people on YouTube who, let's just say, they lack confidence in the Haitian government. So if they lack confidence in the Haitian government, this was even before COVID-19 happened, how will they have confidence in what you are saying the government is trying to do right now, when there are, even though it looks like Haiti may have escaped some of the worst of the COVID-19 pandemic, there are lives at risk people's health is at risk in Haiti?
There's only one way to express your concern is through the ballot vote. You need to, if you do not have faith in the government, change it. And it's in our democracy, we choose election to actually change our elected officials. The government, that's exactly why the president, the current government, is committed to organize fair and transparent elections at the end of the year, so we can have a new government where actually those people who do not have faith in this government can actually choose the leaders.
Yeah, they can just vote you out. All right. They can speak at the ballot box.
But the minister mentioned the structural issues. I mean, historically, Haiti has relied on NGOs and outsiders to fund its healthcare. It has one of the lowest spending, on healthcare. The question is whether or not a new constitution is going to address people's basic needs. I mean, I've seen this argument raised that the issue for Haiti today in terms of, disease and maladies is not COVID, but it's infant mortality. It's women dying in childbirth, things that are curable that we take for granted here in the developed world. And that goes back to, regardless of what your constitution says, what is the political will of any government to address that and to address people's basic rights?
I would like to add something. I think it's a bit irresponsible to say that Haiti is past COVID. I know we don't want to return on that subject and talk so much.
Actually, Jess, we do actually, because that's the whole point. That's what got us talking here.
Right.
And I don't believe anyone said that we're past COVID. I was like, how do you trust the government if there are multiple other issues? Jessica, I would love you to respond to this comment, because we came to you to talk about the vaccine hesitancy, and this is a very well-off Haitian who's thinking about choices and thinking about vaccines. And have a listen to his comment, and then come off the back of it immediately.
When we look at the COVID-19 numbers for Haiti, about 12,000 cases and 250 deaths, Haiti remains a mystery. We even had Carnival early March, and it did not result into accelerated number of cases. The average Haitian today is concerned, marching in the streets, taking over social media with the hashtag Free Haiti, not from COVID-19, but from insecurity and corruption. At a personal level, taking the vaccine is not on top of my priority. However, as a frequent traveler, if it comes down to travel restriction, I am open to take the vaccine. But since I know that there are different types of vaccine out there, I'll make sure I take one that doesn't create more issues than it solves.
Yes, that is a voice of privilege if ever I heard one. Just very briefly, we're right at the end of the show. What should Haiti be thinking about doing right now in the global pandemic? Best practices, best idea going forward from this point?
Right. So following Carnival, actually, when I was speaking with a doctor at General Hospital, the General Hospital in Cap Haitian was actually on quarantine a couple weeks after Carnival. So we just don't know the stats, the statistics. We just don't know how Haitians are being affected by this, because there are underlying conditions connected. However, to address this, it's very, very difficult to get people to trust in the vaccine when most people don't trust in public institutions, when people have bigger stresses to worry about, like food, jobs, security. I think when it's possible to hold elections, I think that's what's going to help return to some trust. The second thing is, I agree that there needs to be more efforts done to educate and fight against disinformation through communication. At the beginning of the pandemic, actually, Haiti did quite a good job at spreading awareness through radio, jingles, and stuff like that.
Thank you, Jess. Thank you, Jacqueline. Thank you, Dr. Pop. And thank you, Minister. Thank you, YouTubers, as well, for being part of this conversation. So much to unpack when we're talking about Haiti, always, particularly during a global pandemic. Thank you all for being part of this conversation. I will see you next time. Take care.